2022, and I am with PsyConnect for the past few months. And today we are all gathered here for this special topic, Therapy 101, as all you are aware of this meeting. So I welcome all of you and also our meets special guest, Miss Mahima Nagpal. We will be discussing on various aspects of therapy, like what is it, why is it needed in today's world, what are the main causes why people need it, and it is a very crucial aspect to be discussed because of rising cases of depression in India, depression and bad mental health. These are all the cases which are daily come in newspapers and all. You all are aware. So we all also be discussing about its significance in the contemporary world, therapy, and Miss Mahima is with us. She will share with us all. So let's start. And now I ask ma'am to shed some light on this topic and tell us about the same.
Yes. Hello, everyone. Good evening. How are we doing today? Are they allowed to switch on their mics, or is it disabled for everyone, Devansh?
Yes, they can ask in between if
All right.
that
All right.
that
Okay,
is up
so
to you,
guys,
ma'am.
can we have the videos on, please? We are going to spend the next 1 hour together. तो एक दूसरे की शक्ल देख लेते हैं. तो आ जाइए जल्दी से.
Yes, guys, please switch on your
ऐसे
camera.
खाली ब्लैक स्क्रीन से तो नहीं बात कर पाऊंगी मैं 1 घंटा. जल्दी से आ जाओ. Let me know we're here. How are we doing today? How's the weekend going for us?
Yes. Network problem is another issue, ma'am. That's why some people are hesitant, maybe.
Yes, female. Okay. Okay. Shoki, what was that in context of?
Actually, that I asked ma'am about Shoki that whether
Okay, okay.
it was a male name or female name. So
Okay.
to that she replied that she is a female.
Yeah,
Great.
that was the
Thanks
point.
for replying, Shoki, and thanks for coming on camera. I really
No,
appreciate
it's
that. While no one else is planning to listen, किसी के कानों में जू नहीं रेंग रही है फिलहाल. So, do we prefer Hindi? Do we prefer English? Do we have any preferences of language?
I guess English is good, ma'am.
Works? Okay. English. Okay. All right. Okay, so I'll generally keep it in English, but then we'll have a bilingual. And in case you don't understand anything, do let me know. Okay. Are we all from the psychology background?
yes.
Anyone who's not from the psychology background? कोई जो नहीं है, they can raise their hands or however they're comfortable letting me know. Unmute, raise hands, write in the chat, whatever works for you. Is there anyone who's not from psychology? Okay. Yeah, great. So then we have some idea of what we are going to talk about. What is a session? Why do we have a session? क्या context है यहाँ पे हम session का क्या बात कर रहे हैं? Obviously, then in case we know that we are from psychology, it's not a sales session I'm talking about. It's not a session with a doctor. It's not a session with a I don't know your manager, anything else. So what do we mean by a session here? How do we take a session? Therapy 101 क्या क्या बात करने वाले होंगे हम यहाँ पे? ऐसे ऐसे मोनोलॉग नहीं आता मुझे देना. I need people to reply. I need people to switch on their videos. Come on, guys. What's the point? We're spending 1 hour of our life for no reason.
Yes, anybody wants to say something, they can ask to ma'am. Like as ma'am asked, what is the purpose? Why do we need therapy? Are you having questions in your mind? If yes, then please ask. It will be great for ma'am to
Hmm.
then follow along the topic.
See, I can go ahead, give a monologue. That's possible, but that's not preferable. And I don't think you would want a monologue either, because what's the point, right? What do we do with a monologue? How is that
Ma'am,
going to be helpful? हम अपनी life का एक घंटा spend करने वाले हैं on something. Let's actually make the most of it, right? Okay. Yes.
ma'am, we can start about your journey of how you became psychologist and
All right.
what inspired you, and then we can go on in
Okay.
the
Yes, we can
topic.
do that as well. Before doing that, I would want to know from all of you, why are you here? Why are you here today in the session, and why are you here in psychology? ऐसा क्या अच्छा लगा आपको psychology में?
Can I answer?
Yes, yes, okay.
Okay. So
Yes,
I am here because I want to practice someday after I
Okay.
finish my masters, and this session is relevant to me because I have scored quite a bit in my masters and my bachelors as well. But when it comes to actually conducting a session, or when it's like when you actually implement the skills that you have learned throughout these years, it's almost like I don't know where to start.
Right.
So I really need to know how to start things with clients, and also how to proceed with it, because yes, I've done internships and they've really been helpful, but I have never really had the opportunity of interacting with clients as somebody who has some authority. I'm always an intern. I'm always working like an intern. So I need to know how to actually do this before I get into the field. So that is the reason why I want to attend to this session.
Okay, perfect. Great. So thank you for sharing that, Shokhi. And similar to what she mentioned, I had a very similar experience right out of masters. Also,
yes,
plus
ma'am.
I
We
had
will
my
get to know.
masters majorly. Yeah, Devyansh, do you want to say something?
Yes, ma'am. We can begin the session with your insights.
Yeah, all right. ठीक है, I'll do that. Great. So when I started off, in fact, started off से पहले when I was in my masters, most of it happened during COVID, and most of my bachelors actually. So the framework at that point कि सबने बोला था COVID batch है, ये तो क्या ही करेगा, ये है वो है. I feel like I overcompensated with doing a lot more at that point with internships and apprenticeships and God knows what. Every time, like, didn't even expect that from you, but I did that. And even then, I would feel like, now what? Because in an internship, you have something to fall back on. You know कि आपके पास कोई सेफ्टी नेट है, आपने कुछ गड़बड़ किया तो संभालने के लिए कोई है, right? Plus, इतना कोई मेजर गड़बड़ आपके हाथ में है भी नहीं, since you're an intern. You can't really mess with someone's life, at least yet. So what about later? What about, I'm just out of masters. I'm technically a psychologist. I am technically completely legally equipped to take up a session. Right out of my masters. मतलब degree मिलने से भी पहले मेरी marksheet आने के just the second I get my marksheet, I'm supposed to be able to take a session. But I was not very sure of doing that because I didn't want to do that to someone's life. I didn't want कि अगर कहीं मैं कुछ ऐसा बोल दूं, because apparently they're coming to me with so much confidence that okay, this person would know how to deal with me, and this person will give a solution to my life and all of that. Of course, we're not giving solutions, but that's what they're coming with, right? That's the notion, at least they start off with, for anyone who's recently starting to understand therapy or the
That's why
concept.
it is a taboo, means it is still not validated by the Indian parents in our society even today, and there is very risk involved in this profession. That's why
Exactly.
people are very scared.
True, exactly. And even then, even if someone finally gives some amount of importance to mental health, तो उनका पहला go to होता है साइकेट्रिस्ट, चलो दवाई दे देगा, एक्चुअली ये तो बात ही करेंगे, राइट? तो मतलब लास्ट ऑफ द लीस्ट पॉसिबल में आता है साइकोलॉजिस्ट या थेरेपिस्ट की, ठीक है, अब इनके पास चले जाते हैं. So they don't realize the fact that ये बिना दवाई के, बिना chemical डाले, and of course I'm with utmost respect to psychiatrists because what they're doing is very difficult, and I have worked with a psychiatrist, so I know how difficult it is to get to that also. But without doing that, imagine you're not even putting that, you're not even putting those chemicals, and then trying to treat someone with that similar intensity. How difficult might that be? Which was the context that I had in my head, that how difficult might that be? What if I end up saying something that they're taking with them for the rest of their life? What if I say something they disagree with and I feel bad about it कि अरे ये तो मैंने शायद कुछ गलत बोल दिया उनको कि अब क्या करूं? I go in that guilt for no reason even if they haven't taken it that strongly. So all of that, while I was in all of that, I remember some of my mentors giving me this information that I have made now PPT and sharing with you guys today. So let's get to that. Okay. What do you think is the first most important thing you need with your client? एकदम बेसिक मतलब आपका थ्योरी आपका थेरेपी पढ़ना is of no use if you don't do this.
Listening them without judging.
Wonderful. Perfect. Yes. Listening without judgment. Anything else? This can lead to a good, ठीक है, empathy, wonderful. Therapeutic relationship, perfect. Therapeutic relationship, empathy, listening, non-judgment, the basic counseling skills that we talk about, and as basic and as cliche as we call them, कि अरे वही ना जो starting में हमने पढ़ी थी, starting की skills पढ़ी थी, they are very, 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 very important. I can't emphasize the very enough for it. Because no matter what therapy you know theoretically, सीबीटी छोड़ो आपको डीबीटी भी बताए ना पर आपका अच्छा रैप ऑफ नहीं बना उनके साथ यू कांट डू एनीथिंग विद दैट डीबीटी विद एक्लेक्टिक विद आरईबीटी विद साइको एनालिसिस फॉर दैट मैटर कुछ नहीं कर सकते उसका आप अगर वो इंसान आपसे बात ही नहीं करना चाह रहा है that person is not comfortable sitting in the same room with you can't do dbt art and god knows what with them ठीक है so very 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 that's very important and that's what we're going to start with. So I'll just share my screen. Anything anyone wants to say before I start doing that? Any questions, any doubts, any issues that we are dealing with personally in this field? कि क्या करें, कैसे करें? Any personal cases that you want to talk about?
Ma'am, excuse me, am I audible?
Yes, you're audible.
Good evening, ma'am. Ma'am, my name is Lovely, and I'm pursuing my master's in psychology in second year. So, starting by starting this journey of MSc and everything, everyone has the similar doubt. I mean, I was starting at this journey. I wanted to be a perfectionist. Like for example, every time I just wanted to be, the when I used to watch MPhil students, especially the PhD seniors, they were the seniors in the department. So whenever I used to see them, used to say to myself this, that how polished they are. I mean, skills. And look at me. I used to compare myself to those people. Especially, biasness come over there. I started, uh, calling myself that why they are so perfect. And after watching the session also, I am not able to, address these issues properly. Not even proper MSc. I used to made, but now I'm in second year. That even honestly speaking, to be like to speak in to go in short, since time limit is there. So uh, I I have chosen my specialization in counseling, and in psychiatry department I got internship, and more than my counseling, I got expertise in clinical. And if you ask me more of the counseling, then I will be able I then my professor said, you were we asked you to do internship in clinical counseling only, and you did in clinical. तो मुझे clinical का सी एंजाइ जितने भी disorders हैं वो इतने अच्छी तरीके से learn हो गए हैं कि like they are wondering, I'm still wondering. जिस दिन मेरा एग्जाम था उससे पहले भी आई वाज स्टडिंग, तो मुझे ये लग रहा था कि आई एम अ स्टूडेंट ऑफ क्लिनिकल साइकोलॉजी, नॉट द काउंसलिंग. जो मुझे करना था वो तो हुआ नहीं, क्लिनिकल में ज्यादा डेप्थ हो गया. और मैम वो मेडिकल सेटअप था गवर्नमेंट हॉस्पिटल का, आरएमएल या ऐसा कुछ, तो वहां पे उसका ज्यादा एक्सपोजर मिल गया. मेडिकल लाइन का ये दो चीजें ज्यादा हो गई, जो होना चाहिए वो कम हुआ, ये चीज ज्यादा हो गई. ये चीज मुझे शेयर करनी है. थैंक यू.
Thank you so much for sharing that. And I think that does also at times happen with a lot of people. Like maybe you've been more in a counseling setup somewhere. Like आप छोटा कोई clinic है वहाँ पे बहुत ज़्यादा counseling psychologist के साथ for example आप work कर रहे हैं. You've done clinical psychology. You've not done MPhil yet. you're still a counseling psychologist. And then, both ways, like she mentioned ki counseling mein hote hue clinical ka exposure tha. I've seen the opposite also happening ki clinical mein hote hue counseling ka exposure, which good. Don't take it as कि अरे यार ये जो करना था वो भी नहीं किया, ये करके क्या करूं. Trust me, both of them are very important. It's lovely and great that you do have that information, and are able to understand the diagnostic aspect of things also. It'll come in handy either ways. One, two, no information in general ever goes to waste. मतलब तुम पायलट बन के यहाँ गए होते ना, मैं तो भी बोलती कि शायद वहाँ की कोई इन्फॉर्मेशन, वहाँ का कोई साइंस, वहाँ का कोई मैथ, सम कैलकुलेशन, सम नेविगेशन यहाँ पे काम आ जाएगी लाइफ में. तो इट्स गुड यू हैव दैट इन्फॉर्मेशन. ये तो अपने ही फील्ड से ही रिलेटेड है, सो इट्स never going to waste, so don't get disheartened about that. So it's great that you have this information. And counseling ki, of course, since you're in the field, you'll be getting that as well whenever you're getting exposure in that field too. So good job. Thank you so much for sharing that. Lovely. Okay. Anyone else wants to say anything? All right. One second. Divyansh is not here. I cannot share the screen. Can I get the rights for that? Whoever is joined from PsyConnect. Done. Yeah, got it. Thank you. Okay. Okay. So how do we start with this therapy session? The first and the first, is the screen visible to everyone? Guys?
Yes, it is, ma'am.
Okay. So the first session that you start with, like I mentioned, keep all your, your own thoughts, your own values, myths, facts, information, theory also out of the room at that point. Literally even your theory. आपका जो भी आज तक सीखा है कि ये फॉर्मेट यूज करेंगे, इसके बाद ये क्वेश्चन पूछेंगे, सब 2 मिनट बाहर रख दो. ठीक है? Because it doesn't have to just be with that. When I say this, I don't mean that, don't go prepared, ऐसे चले जाओ तो गप्पे मारने जा रहे हो. Obviously, that's not the idea. We'll get to that. But the first very session, my first thought, my goal for the first session is not about ये information निकाल के लानी है मुझे उसके अंदर से. The goal actually is to be able to maintain and start actually build a rapport enough that over time they have no issue giving you ये information plus so much more. And again, rapport is not just a first session thing. It's something that we do before every session, during every session. In case that day they're already very pissed. For example, आपने बहुत अच्छे से rapport formation किया, and maybe the third session, fourth session, चलो, good rapport formation हो गया. They've shared a lot about their childhood, their issues, everything. Fourth session, they were very pissed about something. बहुत मतलब irritated आए थे, boyfriend से लड़ाई हो गई थी, girlfriend से लड़ाई हो गई थी. And you started off with, अच्छा, okay, so yeah, last session we were talking about this, let's continue. ठीक है? And that person is going to be like, excuse me, एक हफ्ता हो गया तुमने पूछा मुझसे कि मुझे कैसा लग रहा है इस एक हफ्ते में. What if I don't want to continue that right now? What if I wanted to cry about something else? I gave importance to कि मैंने यहाँ छोड़ा तो मुझे वहीं वापस शुरू करना है. मेरे क्लाइंट के लिए मेरे साथ रैपो खत्म हो गई कि you didn't care about कि आज तो मुझे कुछ और बात करनी थी, आपने मुझसे पूछा मुझे क्या बात करनी थी. What if I didn't want to talk about that? Why was your technicality so much more important than what I wanted to do at that point? When I say all of this, of course, I don't mean it's a client-led session. Client को जो मन कर रहा है हम उसके साथ कर रहे हैं, गप्पे मार रहा है तो मार रहे हैं और सुनते जा रहे हैं और bye bye. No, of course, theoretical aspect comes into play. But right now we're not just discussing that. Theoretical हम करेंगे, हम अपने मास्टर्स में, बैचलर्स में हर जगह पढ़ रहे हैं, इंटर्नशिप्स में भी इनफैक्ट बहुत थियरी कर रहे हैं. उस थियरी को लाएं कैसे? First, we need to have a very interactive relationship. ठीक है? It is a two-way relationship. However, it has boundaries that we need to understand. When I say two-way, it is not, you are not their friend, they are not your friend. No matter how much personal information they've shared with you, you are not their friend. No matter how much they think that you are their friend, you are not their friend. Yeah, you can be friendly with them डिपेंडिंग ऑन द एज ऑफ द क्लाइंट. कोई छोटा बच्चा है तो उनके साथ आप वो बाउंड्री ज्यादा नहीं मेंटेन कर, यू एंड अप डूइंग इट इन अ पार्क, मे बी अ सेशन इन द पार्क और समथिंग. But you need to know that at all points that there is a boundary that you maintain with that person. Okay? It is collaboration. When we say collaboration here, we mean that anything that we are discussing, any conversation that is happening with them, is not just one way. There are times when you share about yourself also. There are times you do self exposure. There are times you can give information like maybe related with a client, in case you don't want to talk about yourself. या फिर इट इज सम पर्सनल इन्फॉर्मेशन जो आपको लगता है कि आपको अपनी नहीं देनी चाहिए फिलहाल, इवन फॉर सेल्फ डिस्क्लोजर. यू कैन से दैट दिस XYZ थिंग, my client had this issue and this is how we got through it, instead of saying ये तो मेरा issue था and I got through it. That in case that is that much more personal and that shouldn't be going out to the client, because then they have a different outlook towards you. They might look at you differently. अच्छा ये तो अरे दोस्ती है, इसके साथ भी ऐसे होता है यार, इसका भी बॉयफ्रेंड छोड़ के चला जाता है, ये तो समझ जाएगी. We don't want that. We don't want the client to think like that. Yes, you can say that, I've been in a similar situation. I get how disturbing this must be, right? So I remember I got this client once. She was around my age, and so everything that she would talk about, in fact, yeah, just a couple of months over here and there, and everything she would talk about, she would say, you would understand, you've been in that age, right? So yes, it's good that she has a rapport with me, that she can say that, or she thinks that I would understand, but not at the cost of the relationship of the session, or the client counselor relationship. So I know I had to make that boundary enough that yes, I do understand, since I am at a similar age and I understand the concept of this generation. However, I am not at your place. 2 months, array, great. Hopefully this will be information he remembers at some point unconscious mein. Okay, so I had to maintain and build that boundary with that person ki yes, I understand this generation concept. However, I don't understand where you are coming from, so help me understand that. क्योंकि मैं जितना भी बोल दूं कि अरे मैं तो सिमिलर जनरेशन की हूँ, हाँ मेरा भी बॉयफ्रेंड ही छोड़ के गया था, मुझे पता है कि यार तेरा ब्रेकअप हुआ है तो कैसा लगेगा. I still don't know the exact situation. I don't know how her coping patterns are. I don't know कि उसका उसके बॉयफ्रेंड के साथ कैसा रिलेशनशिप था, छोड़ के गया है तो उसको कैसा लगा है. मे बी मुझे बुरा लगा, उसको नहीं लग रहा. मे बी मुझे नहीं लगा, उसको बहुत ज्यादा लग रहा है. I cannot bring in my own, values into that. I can't be like, oh, अरे तुझे तो फर्क ही नहीं पड़ रहा है यार 3 साल की रिलेशनशिप की, come on, मुझे तो लगा था बुरा. I cannot do that, because then what's the point, right? If I end up doing this, then where's the rapport and the non-judgmental aspect of it? So when I'm saying I need to be understanding, I need to be only understanding within that realm of the boundary also, which is very important, which we end up neglecting when we are saying being understanding. Being understanding, being empathetic is from a point of view कि अगर मैं इस सिचुएशन में होती तो मुझे कैसा लग सकता था. Not कि अरे यार मैं इस सिचुएशन में थी तो मैंने तो ये किया था, तू ये कर रही है. No, that's not being empathetic at all. ठीक है? That's trying to be their friend. You do that with your friends. कि अरे पागल है क्या? ऐसे नहीं बात करनी थी इससे. मैं बताती हूँ. No, if you're a psychologist but you have a friend and you're not their psychologist, you can perfectly happily do that. Go ahead, have fun. जाके उसके बॉयफ्रेंड को भी तुम भी गाली दो अगर उसकी कोई लड़ाई हो गई है तो. But as a psychologist, you are not doing it. As a psychologist, you are not biasedly being on her side कि अच्छा तेरे बॉयफ्रेंड ऐसे बोला, हाँ वो होगा ही गलत. No. Then what's the point? If you're just being a friend, what's the point of her paying you and coming to you, especially making an effort to come to you, when you also are not able to help her see two sides of the situation, right? Okay. Any questions? Any doubts? Okay. Positive reinforcement at any point. हाँ yes, lovely, बोलो.
मैम जो बुक्स में मेंशन होता है लाइक कि यू शुड बी वेरी काउंसलर शुड बी दिस एंड दिस, जो एथिक्स हम लोग पढ़ते हैं रियल लाइफ में व्हेनेवर यू वेंट टू एनी क्लिनिकल सेटअप स्पेशली इन गवर्नमेंट हॉस्पिटल, सो वहाँ पे वो सब चीज फेल हो जाती है बिकॉज इन साइकेट्री डिपार्टमेंट दे आर उनके उनमें एक से ज्यादा साइकोटिक सिम्टम्स बहुत ज्यादा होते हैं. तो वहाँ पे थोड़ा हार्श होना पड़ता है, टोन को थोड़ा रखना पड़ता है, बिकॉज उसमें लिखा है काउंसलर शुड बी पोलाइट.
Right.
दैट इज व्हाट वी हैव आल्सो एवरीवन हैज रेड इन एथिक्स. तो
Mm-hmm.
वहां पे वो चीज पॉसिबल हो नहीं पाती है. एंड और भी मेनी अदर थिंग्स आर आल्सो देयर मेंशन कि ये होना चाहिए, ये इतना डिस्टेंस होना चाहिए, काउंसलर को ये करना चाहिए, बट रियलिटी में वो चीज एंड अप जा हो जाती है, एंड अप होती है फ्रस्ट्रेशन या इससे ज्यादा, बिकॉज वो लोग सुनते नहीं है. एक होता है
Right.
नॉर्मल आपके पास पेशेंट आ रहे हैं, और वहां जहां पे मैंने करी थी वहां पे, बिकॉज सिंस इट वाज लॉन्ग 10 month इंटर्नशिप. तो
Yeah.
तो वहां पे जो भी थे, आई मीन जो भी पेशेंट्स आते थे अराउंड डेली के 150 160 और मैक्सिमम 220 250 केसेस, तो ऐसे केसेस आते थे. और मोस्ट ऑफ देम वर मोर देन मॉडरेट टू सीवियर सिम्टम्स.
Right.
तो
Hospitals generally, yeah, that's the case.
एग्जैक्टली मैम, तो उसमें क्या है कि उसमें उनको उसमें काफी चीजें चेंज हो जाती हैं. आई जस्ट वांटेड टू से कि अकॉर्डिंग सिचुएशन के अकॉर्डिंग वी नीड टू सी व्हाट एक्शन हैज टू बी टेकन एट द साइमल्टेनियस सिचुएशन. बिकॉज एट टाइम्स कभी कभी ऐसा होता है, एक केस आए थे सुसाइड केस. उसमें इन एथिक्स वी हैव स्टडीड के काउंसलर को ना मेंशन, मतलब इंफॉर्मेशन डिस्क्लोज नहीं करनी चाहिए.
Right.
बट कभी कभी सिचुएशन इतनी ज्यादा उस टाइम वर्स थी कि उनके पेरेंट्स को इन्फॉर्म करना वाज इम्पोर्टेंट प्रायोरिटी ऑफ दैट टाइम.
Right.
बिकॉज वो 2-3 बार शी ट्राइड टू कट हर रिस्ट. दैट 14-year-old girl, she tried to cut her wrist in front of us. Like she tried, but she couldn't. तो उस टाइम पे उसको वार्ड में शिफ्ट करना था. देन उस टाइम पे उनके पेरेंट्स को इन्फॉर्म करना, दैट वाज आवर बिगेस्ट रिस्पॉन्सिबिलिटी.
Mm-hmm.
बिकॉज कभी कभी एथिक्स के अगेंस्ट भी जाना पड़ता है,
Right.
उनको मतलब प्रोटोकॉल ब्रेक भी करना पड़ता है. तो इट्स अकॉर्डिंग टू यू दैट यू नीड टू डिसाइड अप्रोप्रिएट टाइम पे क्या एक्शन सूटेबल है. दैट इज व्हाट काउंसलिंग एंड एवरीथिंग इज ऑल अबाउट. थैंक यू मैम.
Thank you so much. And very nicely, very perfectly put across, lovely, that it's, again, like I said, it's not just what we read in the books. A lot of it, I don't mean all of it, obviously, ki padho hi mat, marks mat lawa rahe, chodo masters kaam kariye, aisa nahi hai, of course. But a lot of it goes out the window when you're actually sitting in the clinic or with your client. Because, so for example, I remember there was this, like she said, firmly baat karni hoti hai. In office, in hospitals like Ibhas is a government hospital again, like she mentioned, and there are, matlab, ऐसे files, like at least 50 files a day with each doctor, and there are about 10-15 doctors sitting at one time, matlab ek usi same day pe, and then they have like a rotational OPD and all that. So imagine that's an easy 500 patients per day, general aspect पे जो हम देख रहे हैं, ठीक है. And imagine for a person who's seeing 50 cases, पहले तो जो एक दिन का 50 cases देख रहा है, उनका burnout कितना होगा. You're not, if they are talking about random stuff, they are talking about like we say that, okay, catharsis. But there are times when we need to stop their train of thought because we know कि वो सिर्फ deflect करने के लिए कर रहे हैं, or they don't actually want to share what they should be sharing at this point, या something that we need to probe them on, वो नहीं करना चाह रहे हैं, तो they're just going on a 2-hour monologue about something or the other, which is not related, right? So we need to know when they are doing that and stop them at that, confront them at that. Not just keh rahe, theek hai, catharsis hai, non-judgmental hai, sab suno. At times it's not necessary. Even in a session where you're taking like 5 sessions a day, it's still probably not required a lot of times, because you need to understand that is it being deflection or is it actual catharsis. Then the distance that she mentioned. I remember there was this, so it was my first internship ever. Like in bachelor's मैंने किया था. And the clinical psychologist, I was also doing it so I have done clinical psychology, and I was doing it with a clinical psychologist. And one of her clients, she was young, less than 18 years old. And she cried and she hugged the psychologist. So I just asked her when the client left, कि मतलब ये तो नहीं करते हैं and all that, हमने पढ़ा है कि नहीं करते हैं. And the psychologist, this was the first line she told me, कि जो पढ़ा है ना उसको लेके मत आना मेरे क्लिनिक में. Because again, yes, obviously theoretical aspect aside, but she was like, there are so many things, so many times that we do that. She was crying. She wanted that hug. She wanted to come to me. And I'll be like, नहीं यार नहीं मुझे नहीं करना. Hey, Rapo, gone for a toss. That person would not even want to come to me. She's fragile enough. She's less than 18. She's a teenager. Fragile enough to not want to come back if she doesn't. She can throw as many fits as she wants to her parents if she doesn't want to come. And she wanted that. She wanted a human connect at that point. Ki shayad isse she'll feel better. My plan is to make her feel better. It's okay to do that at times. In fact, even I remember when our psychologist, our school counselor was a psychologist as well, and she said that it's not going to be initiated by you. Yes, but if someone's coming in, again depending on the security aspect, privacy aspect, vagera, vagera, if you're comfortable with the person who is there, your comfort also matters in such a situation. But your comfort matters, not the theory you've read in your books at that point. कि नहीं करना है इसलिए नहीं कर रहे हैं. If you're okay with doing that, it's cool. It's fine to have that connect at times when required. And the privacy, there are some exceptions to the confidentiality clause जो स्टार्टिंग में इन्फॉर्म्ड कंसेंट में साइन करवाए जाते हैं. 18 से नीचे हैं, सेल्फ हार्म की टेंडेंसीज हैं, सुसाइडल टेंडेंसीज हैं, कुछ लॉ ब्रेकिंग जैसा कुछ हुआ है मेजर, समथिंग दैट इज जस्ट हैपेंड एंड समथिंग दैट शुड बी रिपोर्टेड. ये सारे कॉन्फिडेंशियलिटी क्लॉज के एक्सेप्शंस हैं विच आर साइंड इन द वेरी बिगिनिंग फॉर दिस वेरी रीजन कि ऐसी सिचुएशंस में बताया जाएगा फैमिली को. बिलो 18 आप फैमिली आसपास नहीं है और आप दीवार पे सर मार रहे हो ना, वो भी फैमिली की गलती मानी जाती है इन इंडिया एटलीस्ट टिल डेट. इट्स I remember there was this client I got. She was 14. She had been self-harming, matlab had been past continuous at 14, imagine. And she opened up about it by the end of the first session around. So we talked and we started off, so she started off very closed. बहुत ऐसा कि मतलब, you know, एहसान करिया कि her school asked the parents to get it from a psychologist in written that she's allowed to sit alone. Till then, they had asked the parents to sit somewhere near the class कि हम क्लास नहीं लेंगे, इसको सेशन क्लास में नहीं बिठाएंगे जब तक इसके पेरेंट्स आसपास ना हो. The parents only came to a psychologist कि psychologist आके लिख के दे दे उनको पेपर पे कि now she is fit to sit. Because they were saying कि हमारा काम में टाइम वेस्ट हो रहा है, हमें अपना काम करना है, हमें छुट्टी लेनी पड़ रही है. And we tried to understand कि ठीक है, when she did open up, she was self-harming for a while, not to show to the parents. In fact, she was not even doing it on the arms कि easily दिख जाएगा. She was doing it at places where it was not clearly visible to the parents. And it started off firstly with self-disclosure. We ended up bonding over something very common. She was like, oh, I also dance, I've learned something, I have learned Kathak as well. So we bonded over that, and that's how rapport started. It was nothing related to psychology and her issue. Then she wanted to talk to me. अरे पता है फिर क्या हुआ था करके she started. And 1, 2, when she mentioned this to me, her parents' idea was कि ये तो attention के लिए कर रही है. मतलब छोड़ो, चलो attention के लिए ही कर रही है. Imagine a 14-year-old having to do this for attention. तो दे दो ना attention. इतना अगर आपको लग रहा है attention के लिए करिए तो give the attention. Why should a 14-year-old have to take such extreme measures for attention? Right? So I told this to them. This was the exact line that I mentioned to them, that she's not 18. She comes into my room here and she bangs her head, or in a room alone, there is no one else. She comes and she bangs her head. You are responsible even if you're not there, because she's not 18. So don't come and tell me कि अरे यार हमारी responsibility नहीं है, वो तो 14 साल की हो गई है, वो उसको तो attention के लिए कर रही है. It is your responsibility, and we're not writing it on a piece of paper that she's fit to sit alone just because you have work to do. Right? Because she was not at a position where she could have been in that situation. She should have had supervision around her at that point, and school was doing their part in that. So all of that is important. It's important to know when you need to get out of the book. Okay. Okay. Yes, Devansh.
Hello, ma'am. Hello, everybody. I'm new to this. Actually, I'm a neophyte learner to the psychology, right?
Okay.
I don't have any like specifications, any studies around this. But yes, I do several like searches on websites. I do meet with the people and do several types of counseling to like study this and examine these kind of things for the counseling purpose and for the beneficial of the people living like living in the surrounding. So my question is, the information you are providing right now is for the specific type of people, like of special category, or the people who are like have any kind of disorder or psychiatric, is that of any kind?
See, in this situation, it is anyone who's coming for a session. It could be any client slash practitioner relationship where the practitioner is generally, the context is a therapist. It is also the context with anyone who's dealing with a human being. The numerologist, for example. Also, yes, most of my context and my examples are related to psychology because that's the idea behind this therapy 101. But anywhere where I'm dealing with a human being, I need to be empathetic, I need to be non-judgmental, I need to listen to them. Even the starting basic I gave कि ये sales pitch नहीं है. Even in sales, you need to be empathetic and understand their needs. हाँ, आपको अपना प्रोडक्ट बेचना है, but आप उसमें भी you put it across in a way that they feel like they need the product instead of saying कि मेरा प्रोडक्ट ये करता है. These are the basic sales techniques people are taught ना, कि instead of saying कि मेरा प्रोडक्ट ये कर रहा है, tell them how मेरा प्रोडक्ट is helping them. So for me to say it that way, I need to understand what is going to help them, right? So anywhere where I'm dealing with a human being, I need to be non-judgmental and listening to them, be empathetic towards them, etc. Is have a rapport with them, very importantly. That's a general idea also. But yes, technically here we are talking about the therapy context specifically, is why we have examples more related to that.
Okay, I got that. Thank you for this. And the second question is like, if we are targeting like we are not targeting any kind of specific kind of people. So like if they come to us for the counseling sessions, we have to we have to be in we have to learn certain skills like active listening, active speaking, and we should be verbally conscious for them. And after doing these kind of things, like if they say something to us that is not right, so how can't we be like non-judgmental? We have to give our judgments for that thing. So how should we positively enforce or reinforce our thoughts into their mind? Like they think कि हाँ ये चीज कर लेते हैं, ये कह रहा है तो मान लेता हूँ. नहीं, ऐसा मेरे साथ कई बार हो चुका है कि whenever I do these kind of counselings or when I do the therapy sessions for the people, so what they say कि जो मैं बता रहा हूँ वो आप समझ नहीं रहे. देखो, I do understand them, but what is wrong and what is right. So whenever I try to enforce the positive thoughts into their mind, they feel like I am blocking their thought patterns or intervening between their thoughts. So what's your views about this?
So the fact that one, they are feeling this, मतलब आप अपने client counselor relationship में यहाँ नहीं पहुंचे हैं, that you can say it to them. You're not at a confrontational level in your relationship, firstly. So don't confront them yet. Point number 2, what is right and what is wrong. How do you know that? That is my perception. I say that infidelity in a relationship is wrong. ठीक है, मैंने बोला ये. और मैंने बोला what is right, what is wrong. Obviously infidelity is wrong. अगर वो कर रहा है, ठीक है, मैं तुम्हारा point समझ गई, तुमने क्यों करी थी, तुम्हें you were not feeling loved with the person you were with, so you started falling for someone else. I understand your point, but it is wrong. तो जब मैं ये करती हूँ, when there's a but in my sentence, I don't actually understand their point. Because if I'm saying I understand your point, but this is wrong, I didn't understand their point. I understood their point only to reply with, पर ये तो गलत है ना, करना तो नहीं चाहिए था ना. What if for them it was perfectly right? They are being they are cheating on their partner and showing love to someone else. Their context is कि मैं तो प्यार बांट रही हूँ, मैं एक से ज्यादा को बांटना चाहती हूँ. It's perfectly right for me to do that. And in fact, she's not being hypocritical about it also. उनके partner भी जब cheat करते हैं, she's like, it's okay, वो भी प्यार बांट रहे हैं, it's fine. Who am I to say कि नहीं यार ये तो गलत है? I don't, if it's not coming from an unhealthy pattern at that point at least, I can't say गलत है. Just because मुझे लगता है कि infidelity गलत है, या मेरा boyfriend मुझ पे cheat करेगा तो मैं नहीं रहूंगी उसके साथ की वजह से गलत है. No. या तुम girlfriend cheat करेगी, whatever. I can't be the one to say that. 2, even if I want to, at over time when I want to, get on to working with the issues that they're having, confronting their issues, etc., I need to make sure that I've reached that position in my relationship with my client that I can confront them. Confrontation is way after rapport is formed कि मैं उनको बोल सकती हूँ नहीं भाई ये मत करो, ठीक है, उससे पहले मैं नहीं बोल सकती. The second I say this, they're like okay bye then tata. 3, there are situations in which मैं शायद कभी भी नहीं बोल सकती कि ये मत करो. Why? Because have you heard of this? There's this saying that I can only take the, I think गधे को या पता नहीं घोड़े को पानी तक लेके जा सकते हो बट पिला नहीं सकते हो. सुना है किसी ने? कुएं तक लेके जा सकते हो, पानी थोड़ी ना पिला सकते हैं. So basically, I don't know the exact wordings of it, but it says that I can take a horse to the well, horse or whatever the animal is. I cannot make them drink water. मैं कुएं के पास ले जा सकती हूँ, मैं उनकी गर्दन नीचे करके पिला थोड़ी सकती हूँ. I can get someone to therapy or I can ask them, I can let them know ये है वो है. I can't say that अरे तुम ये तो गलत है ऐसे मत करो. मम्मी थोड़ी मैं उनकी. They will have certain things they want to deal with and I'll help them deal with that. So there was this client I got and he was severe level पे alcohol addict. Okay, severe मतलब उसकी रात ही खत्म नहीं होती है अगर वो at least like आधी bottle पी के ना सोए तो. Every single day, 7 days a week, 24/7. That's his life. That's not even the problem he's come with. He has come because मम्मी ने जबरदस्ती बुलाया and then his problem that he came up with was that I was like कि ठीक है आपके हिसाब से कोई भी दिक्कत नहीं है तो बता दो, then we'll talk to the mother कि नहीं भेजें आपको. अगर आपको लगता है कुछ भी है that you want to talk to us, let us know. Otherwise there's no point wasting your time and money on us, right? So he was like नहीं हाँ थोड़ा बहुत तो है problem कि मेरा ना self esteem low है. Was the only issue he came up with. Over time we got to कि हाँ self esteem low है, so he ends up drinking makes him feel like he can talk to people, etc etc. But for him drinking was never a problem. So I can't go and be his mother and say ना कि नहीं but drinking है तो गलत ना मत करो. मत कर ले भाई, मैं जब तेरे लिए वो गलती ही नहीं है तो मैं तुम्हें कैसे बोलूं कि वो गलत है तो मत करो. Every bottle has whatever it says about hazardous, every cigarette packet has whatever it says about hazardous and smoking kills and everything. कर रहे हो तो कर लो, मैं मम्मी थोड़ी हूँ. I can't work on that aspect when you don't want to work on it. I can only work on things that you are ready to accept and work on. Then it means that one should accept that not everyone has a chance of recovery. Yes, possible actually. Not that this is the case. There are people who end up realizing that over time and you confront them about things जो confrontable हैं, जो एकदम ही in the, like you said, right and wrong, illegal है for example. The right and wrong that I can focus on there, वो भी not always maybe, is illegal and legal. मेरा right and wrong या तुम्हारा right and wrong is nothing that comes into the session technically. Is not supposed to. And if it does, it is my thing to deal with in my own therapy session. अगर मुझे लगता है कि मैं अपने right and wrong का concept अपने client पे डाल रही हूँ तो मैं कहीं और जाके client बन के therapy में deal करूंगी इस चीज से पहले. I'll not impose it on my client or enforce my ethics on my client कि नहीं नहीं यार चीटिंग करना तो गलत है या किसी को मारना गलत है या तुमने थप्पड़ मार दिया हो. अब ठीक है मार दिया ठीक है okay. I would ask them, do you think that's the right thing to do? Unless it is an illegal thing and obviously for a थप्पड़ at least India में तो पुलिस के पास नहीं जाता है इंसान, तो I can't go and tell them नहीं भाई ये तुम मतलब unless I've reached that level in my relationship with that person. Yes, maybe then I can. Unless if it's not reached that, and the fact that you were saying कि वो आपको बोल रहे हैं मैं नहीं समझ रहा हूँ, means that you've probably not reached that yet. ठीक है देवांश, I hope that answers your question.
मैम बस इसमें
Any other questions,
एक
Devansh?
चीज है कि जस्ट अ सेकंड मैम, इसमें ये चीज फिर दिखती है कि मैंने जितने भी लोगों से बात करी अभी तक, जैसे इंक्लूडिंग यू आल्सो, एक्चुअली आई आल्सो टेक अ थेरेपी सेशन फ्रॉम मंजूषा गायकवाड मैम. सो उन्होंने भी यही बात करी थी और बाकी लोग भी यही बात करते हैं कि जो थॉट पैटर्न्स होते हैं, जो एक काउंसलर के थॉट पैटर्न्स होने चाहिए, वो ऐसा अनबायस्ड तो होता है पर कैसा है ना कि वो कोई एक साइड नहीं होता. इट्स 50-50. लाइक you somewhere you have to play on head, somewhere you have to play on tail. So आपको सिचुएशन वाइज देखना पड़ेगा कि हाँ किसको क्या चीज सूट करेगा करके, ऐसा कुछ.
Right, that is true as well. Yes, see, that person should want to talk to me is the first and foremost aspect of it. They do not want to talk to me or to any therapist for that matter. मतलब Obviously, if they have a problem with me specifically, but they're okay with talking to someone else, then you need to be ethical enough to transfer them to someone else instead of just keeping them on just because they're paying you. Shouldn't be done. On top of that, अगर वो किसी से बात ही करने को रेडी नहीं है क्योंकि उनका वो रैपो नहीं बना है किसी के साथ, तो मैं क्या कर लूंगी ना उसको सही गलत बता के सोच के ये सब करके, जब उसने बात ही नहीं करनी है. Imagine a person who's come with like lifelong trust issues and वो फाइनली बेचारा मुझ पे ओपन अप हुआ और मैंने उसको बोला नहीं यार ये जो तू कर रहा है तो गलत है. ये बोले भाई अब जाके तो मैंने किसी को कुछ बोला, उसने उल्टा मुझे सुना दिया, मैं तो बताऊंगा ही नहीं आज के बाद किसी को कुछ. He would not come to me ना. अगर if this concept of right and wrong was something we got into the therapeutic session, तो तिहाड़ में तो psychologist नहीं होने चाहिए थे. There are psychologists in jails also with proper convicted felons जो हो गए हैं, वो हैं.
They are empathizing them, right?
Sorry.
The psychologists in the Tihar jail, they are empathizing the like criminals or the people in Tihar jail कि हाँ जो किया मतलब you should not take the burden. If you are feeling guilty, you have to cope up with these problems. So they are just empathizing them. They are not trying to like making them recovery from their guilty acts, right?
See, it depends session to session. I don't take every session there, so I'm not sure. But it depends session to session who wants to deal with what. If a person is, there can be people who are, in fact, psychologists in Tihar also deal with cases where someone has been wrongly convicted. उसी गाड़ी में था, उसने कुछ नहीं किया, but उसको lifelong sentence या फिर life sentence कुछ मिल गया है, which probably is more than what was required. So then they are also there to deal with such situations and deal with the legal aspect of such situations as well, as far as I know. But I mean, that depends person to person. If they want to deal with guilt, that is something they deal with. As a psychologist, I'm not going in to say कि नहीं तुमने जो किया वो गलत किया या सही किया. I'm not talking about either of it. I'm talking about अच्छा अब तुम्हें क्या दिक्कतें चल रही हैं बताओ. जो किया सही किया गलत किया वो तो हो गया ना, वो तो legal. He is in the legal system. It's established whatever he's done. I am no one to talk about it कि अब तुमने सही किया था कि गलत किया था. मैं क्या करूँ बोल बात करके उसके ऊपर, right?
Yep. Thank you, ma'am.
Okay.
Devansh, have you got your answer?
Yes, I totally got my answer. Thank you.
Great. Yeah, so we'll do one more thing and then we'll get to questions and we'll end the session after that. ठीक है. Body language कितनी important लगती है आपको, क्या होती है कि नहीं होती है? Whatever you want to say on that. Shocky is saying होती है. मुझे कैसे पता चला कि होती है?
Kinesics.
Yes, sorry,
Had you heard about kinesics?
Yes.
Kinesics, proxemics, and paralinguistic features, they are like interdependently connected with this.
Right, exactly. That is connected with this perfectly. Actually, that is exactly what this is, yes. So, how did I get to know that Shocky thinks it is important? Because she nodded her head. मुंह तो खोला नहीं था, उन्होंने unmute नहीं किया था, right? This is how important non-verbals are. Imagine मैं तुम्हारी क्लास में अभी ऐसे पढ़ा रही होती. अच्छा, so then अरे बोलो ना यार, ऐसे बोलती हो कर मैं सोचूं. Would you want to listen to it? I would not want to listen to it. I was getting a facilitator doing this, I would leave the session even if I've paid, let alone a free session. I'm like, छोड़ो भाई नहीं पढ़ना मुझे. Because it is important. Imagine my therapist sitting there like yawning in my session. I'll think मैं ही reason हूँ यार yawn करने का, छोड़ो मैं नहीं बोलती. Me talking is boring them. So my non-verbals are very, very important. Eye contact with the people I'm talking to. Yes, online thoda sa disrupts that, of course, but still looking towards the camera. In an online setup, looking towards the camera is a online parallel to maintaining eye contact. So looking at the camera or again maintaining eye contact, sitting in the right posture, very, very important. Sitting in the right posture. Here, in fact, body language may I end up talking about self-care also. Very important कि आप खुद का ख्याल रखो ताकि आप दूसरों का रख पाओ. Not that psychologist सिर्फ दूसरों का ख्याल रख रहा है, but the concept of being able to talk to them, being empathetic, etc., etc. For them, I need to be mentally healthy myself for it. Just one day of less sleep will break my rapport with my client so bad that it'll take me ages to get it back just to the same level, let alone trying to increase it. मैं एक रात सोई नहीं हूँ और मैंने अगले दिन अपने सेशन में यॉन कर दिया है. ठीक है, he was talking and I yawned like twice. चलो So he'll be like, bhai, just what I said right now, that he'll end up thinking that he's the reason I'm yawning. Even when you're having a conversation with your friends and they yawn, you're like, यार नींद आ रही है ना, चल ठीक है, चल चल तो सोता है, छोड़ छोड़, है ना, चल ठीक है, लेट हो गया. We just end up, we ourselves also try to end that discussion after that. Imagine doing that in a session. वो बेचारा पे करके टाइम निकाल के आ रहा है आपके पास, इतने दिक्कतें लेके, right? The person who feels that it's taking time, money, effort out of my life is still smaller if I get a solution to this problem. इतनी बड़ी problem लेके आ रहा है वो आपके पास, and you're yawning. It will break that rapport. But so इसलिए firstly self care very very important. Point number 2, you are still a human being. It is possible कि आपको कभी कभी नहीं मिले पूरे 8 घंटे की नींद, 6 घंटे पे आ रहे हो और yawn कर दिया, which is why communication and rapport is very important. I remember this happened in fact in one of my sessions. I had come from a trip. I went to Manali and I came back home at 8 a.m. and I went to office at 9 a.m. to my clinic. And मतलब obviously थोड़ा tired तो मैं थी, travel ही कर रहे थे, तो obviously we didn't sleep as much. And I yawned in one of the sessions. And I said it. We verbalized it. I was like, I'm so sorry. I've been like up since the last 3 days. We've been around, so it's not a you thing. The second I yawned, I could physically see him shut off. कि एकदम बात करते करते ना उनका जैसे आवाज का वो चार्म ही खत्म हो गया, जिस चार्म से वो बता रहे थे कुछ इशू या कुछ अच्छा जो भी, मतलब it just became like a flat tone right after that. And then we talked it and then we kind of laughed it off कि हाँ यार मैं भी नहीं सोता जब मैं क्लबिंग जाता हूँ, and then it became normal. It ended right there and we went back to the conversation we were talking about, and again back to the normal pitch he was at. So it's okay to address that you're also human. It's okay to have that communication with your client and have at least that much personal touch that you can say कि भाई इंसान ही हूँ मैं भी, कोई बात नहीं. So that he can have that, she can have that towards you also. ठीक है? Very important to have that rapport because it's fine. You are a human being. Self-care, yes. It is possible for you to also end up yawning or something on those lines. ठीक है, yawn कर रहे हो या phone एकदम से कुछ बहुत important आ गया है. It doesn't mean that you're boring them or they're boring you. It could be that it's genuinely important. It's something at your own house. You have things to deal with as well. It's okay. You can verbalize it there. That I'm sorry, it's an important call. I'll have to take this. Or I'm sorry, I'm cutting you off, but I have to go to the washroom. अरे जाने भाई washroom नहीं तो है, big deal. It's okay. Have that conversation that it doesn't break it off for them. It doesn't feel like कि बात तो बीच में कट गई, अब क्या करूँ, अब तो क्या ही बात करनी, छोड़ो. There are times when we're in that we're in that train of thought और हम बहुत कुछ बताते हैं. But if someone moves out and then they come back, they're like, हाँ बस यही था यार, ठीक है, मतलब और तो क्या ही हुआ था, important नहीं था, छोड़ो. जो वो important नहीं था was important enough that they wanted to talk about it. So get them back to it. Know that you be capable of getting them back to it. All of what we're talking about right now is how you apply the theory or how you're even capable of bringing a relationship where you can apply the theory that you've learned. The idea here was not to learn theory or therapies or therapy में क्या question पूछते हैं, Socratic questioning कैसे करते हैं. The idea here was to be able to use that information with a person. Okay, we had other things, more things in as well, but we did more of
Yes, ma'am. Now, about the contemporary issues you were talking, that what are the uses of therapy in the contemporary world and why it has become so important in today's world that its demand is increasing. So, can you please shed some light upon that topic? It would be grateful for the viewers.
okay. That's a lovely question, Devansh. That why is it actually becoming important? The concept. Have you ever heard of your parents or uncle aunties saying that ये सब तो ना अभी आया, ये mental health, हमारे टाइम पे तो किसी को नहीं होता था डिप्रेशन वगैरह, ये फोन आ गए हैं जब से ये तुम्हारी ना ये सब चलने लग गया है, तब से ही हुआ है डिप्रेशन. Whatever, fill in the blanks they want to put at that point. कभी फोन होता है, कभी इंटरनेट होता है, कभी कुछ होता है, कभी कुछ होता है, reason, whatever. Different things are the reason at different times, but whatever they fill their blanks with and then they say this template sentence. हाँ टाइम पे तो होता नहीं था ये सब. सुना है किसी ने? I feel like at least Indian population I've heard it anywhere. मतलब South India, North India, किसी ना किसी language में तो मैंने सुना है किसी ना किसी को बोलते हुए. है ना. One is that they were not as addressed because the concept of mental health in general was not talked about. अभी तक ही इतना बुरा हाल है, तो तब तो कितना ही बुरा हाल होगा सोचो. अब इतना आफ्टर so many suicides and mental health related deaths and पता नहीं क्या क्या डेथ लेवल पे पहुंच गया, तब लोगों को लग रहा है कि I think it should be dealt with. It is something to be dealt with. कुछ तो है. Let's acknowledge that it is a problem at least, right? अब जाके यहाँ पहुंचे हैं हम. So that is one point, that yes, us samay it was not addressed as much. It did not come up as much because there were less people to bring it up, less diagnosis, less conversation of mental health in general. Also, apart from this, yes, पहले होते भी कम थे. No matter how cliche it sounds and how uncle auntie level it sounds, yes, our phone and amongst a lot of other things is the reason that it has increased over time also. I do not have any social contact anymore. I do not have an actual human relationship with people. दूर दूर के लोगों के साथ मैं फोन पे कनेक्ट कर रही हूँ. I barely have a relationship with people in my own house. I'm living far away from family. I'm living far away from friends. I'm working just with colleagues. उनके साथ भी वर्क रिलेशन ही है कि काम पे बात कर लेते हैं, थोड़ा बहुत इधर उधर की बात कर लेते हैं काम करते करते. काम नहीं हुआ तो फिर we are back to being colleagues and we hate each other because we have not worked on whatever we had to work on. Where is the actual human connect? When I don't have that, I am not actually able to, share things. This concept of so many things of, social gatherings. The concept of religion, for example, even helps with the social gatherings. The concept behind it was कि socially सब मिलेंगे. Males, for example, meet at a workplace. The concept of Karwa Chauth, if in any families it is heard of, I mean, you must have heard of the concept of it at least. कि एक चीज exist करती है even if you don't have it in your families. Was built on the fact that husbands are chalo, at one point in their life they are maybe working. It started off at a point where we had those very stereotypical roles. Male was going out, female was at home, right? Dealing with the household and everything. So at least a female gets some outlet, some social interaction. So there's this whole ritual of females meeting together near a mandir or a temple, and then they're thali wali hota hai, they're doing a storytelling and all that is happening with that. So they're having some social connection there. बातें करेंगे, कुछ तो बाहर निकलेंगे घर से. And it's good for the body because they're at home, they're not walking as much, so the body is fasting one day. It's a detox for the body. That was actually the concept behind a lot of the religious concepts, similar with a lot of other religions. ये बने चीजों पे थे. The roza, the 30 days roza is more of a health reason, more of कि शाम को फिर सब साथ में बैठेंगे. वो सब होता ही नहीं है अब. Where do we have social connect as much? So yes, actually contemporary cases में mental health is becoming a bigger problem. Physical health is becoming a bigger problem. A lot more connection between physical and mental health now. Mental health causing physical health issues causing mental health issues. पहले mental health issues ज़्यादा नहीं थे, physical भी कहाँ थे? Sleeping on cots and like being active because they used to pick up weights and kheti and God knows what. Actually, physical health issues also didn't exist as much. Diabetes as a concept सुना ही नहीं था मतलब in my families when I've heard from my nanu and all. Diabetes as a concept ही नहीं सुना था उन्होंने. Like what is diabetes ये नहीं पता था उनको. Because this concept didn't exist. We're working all the time, we're walking around, ये कर रहे हैं वो कर रहे हैं, तो वो lifestyle issues, PCOD. ये तो in fact our parents' generation also had not heard of as much. It's coming up now. Lifestyle issues causing mental health issues also. So yes, I think that's the increase in the need for mental health and hence the concept of mental health and their awareness. So over time it will increase. I have seen it in my own, career trajectory increasing and changing way too much in just that much time. In about one more around a decade itself. कि कहाँ से कहाँ पहुँच गया है in the way people talk about mental health. So it will increase over time, I think. Yes.
And what do you think, how much time it will take for the tier 2 and tier 3 cities to adopt mental health profession seriously and make it as normal as it is in tier 1 cities?
I think it's not completely normal even in tier 1 cities yet. but
In India.
people, yeah, even in Delhi, for example, tier 1 में आप Delhi, Bangalore, Mumbai ले लो, it still is not, you know, I've heard people in near in Delhi itself, in a very urban part of Delhi, people saying that अरे यार मैं पागल थोड़ी हूँ, तू psychologist, अरे मैं पागल नहीं हूँ. The second my friend would say that, oh, she's a psychologist. Oh, मैं पागल नहीं हूँ. They would say it as a joke. The fact that urban Delhi में उनको ये बोलना पड़ रहा है as a joke means that it's still not there, like you were discussing here. But yes, it will. One and two, even for tier 2 and tier 3, I think it will take time based on the fact that, you know, general every urban development or every rural development takes a lot more time in tier 2 and tier 3 cities. So I think this will take some time to go get there as well. But hopefully we will get there throughout, and this will become as important as physical health, as more important than physical health a lot of times also. But yeah, at least as important.
Some celebrities like Deepika Padukone have also said about depression in the media,
Right.
and things are approaching in that way. In the Bollywood, it has entered this cult to means accept that you have a mental condition. So what do you think, that the common people will accept these things, that they have this, or it will take 10 to 20 years more down the line?
I think it's not a discrete situation that आज ये है exactly 10 years बाद ये होगा. I think it's a ever evolving situation. From the I have heard both, even for Deepika Padukone specifically, I've heard both sides that, you know, it's so courageous that she's come up with it. To come on, you have such an easy life, you can't have mental health issues. Again, the general you know, myths that we have कि अगर पैसे हैं तो mental health issue थोड़ी हो सकता है. You should be happy. तुम तो इतना काम कर रहे हो, तुम तो खुश होने चाहिए हो. Doesn't a lot of times happen. So this side of comment again means that we still have a long way to go, but we have come a long way as well. So when we're saying that it takes time, we should also not fail to acknowledge that we have come a long way as well. So hopefully over time we'll keep evolving and get better at recognizing these issues, and, you know, validating these issues as well.
So any other questions?
Yes, guys, anything anyone wants to ask, say?
Sorry to disturb. Actually, I have ample of questions. So,
Yeah, go on.
my question is like, does complex life lead to more stress in people? Like, if you are being more complex into these studies, like, अगर मैं example लूँ, let's say, डिजिटल का, when digitalization takes place, तो कैसा होता था कि शुरू में कोई दिक्कत नहीं थी, लोग अपनी शॉपिंग कर रहे थे घर के पास से, so they are used to it कि हाँ जितने का मिलेगा ऐसा मिलेगा, तो दिक्कतें कम थी. When people are like choosing the digitalization type of things, तो एक तो स्कैम बढ़ गए, दूसरा साइबर फ्रॉडिंग बढ़ गई, तीसरा जिसके साथ अचानक से हो रहा है मेंटल स्ट्रेस एंड ऑल. तो क्या कॉम्प्लेक्स, जितनी लाइफ कॉम्प्लेक्स हो रही है उतना ज्यादा स्ट्रेस, इज इट राइट?
To some extent, yes, that's possible. But it's not just a yes or no answer, I think, because a lot of times there are people who say that, just give me one second. Yes. So, yeah, like I said, that I don't think it's just a yes or no answer. There are some things that have become better over time. You know, there are also things that have increased and become worse. Stress, hypertension, because of complexities has increased. There are a lot of things that have made our life easier. जो हमारा क्योंकि the life in general has become so much more fast paced that we needed a slower pace for the things that were fast paced. Going to the you know, vendor and getting sabzi and everything took time. हमने जब लाइफ में इतना सारा कुछ और ऐड कर दिया कि हमारे पास इसके लिए काम ना हो, टाइम ना हो, तो फिर हमने ब्लिंकिट और स्विगी इंस्टामार्ट लेके आ गए ताकि ये यहाँ से टाइम बच जाए और यहाँ डाल दें. So the day is still the same 24 hours. We've just kind of reframed how we spend it now, leading to the changes in lifestyle, both good and both bad as well. Okay, so I'll have to take your leave for today. I think Devansh, whatever questions you have, if you can direct them through Devansh maybe, or you can contact me directly Instagram or anything as well.
Yeah, for sure. Okay, thank you,
Yeah,
ma'am.
okay.
And
Thank
I
you,
hope
ma'am,
to
for
hear
your
them for the others
valuable
also,
time.
whoever is
I
here.
think ma'am is in a hurry.
Yeah, yeah. I actually have started. I have a session as well. So, all right. Thank you so much, everyone, for joining. I hope you all had a good time and you
Acha,
did.
ma'am, last question. Like, I want to know a gist about you. Like, what do you like professionally? What are you doing right now?
Okay. Yes, I think we didn't do an introduction because we had to start off. So, I'm a counseling psychologist from born and brought up in Delhi itself. I am now doing my PhD in psychology, majorly towards developmental psychology and counseling psychology. And apart from that, I am a life coach, I'm a color therapist, I'm a graphologist, dream analyst as well. I have my own private practice and I'm also working with colleges separately. So Mind Unnati was the other, if you would have come across PsyConnect. So that is the private practice aspect of things. And I am working separately in Delhi itself. So that's the professional aspect of my life. And I want to share how I have gone from being scared to destroy someone's life to actually taking sessions, hopefully successfully. So that's the idea behind therapy 101. कि हम actually we start understanding how we can talk to the person in front of us and how to get to applying the theory more than just talking about the theory. All right.
Yep.
Thank
Thank
you,
you,
ma'am,
ma'am,
for your
for having
valuable
me.
time. I
Nice
hope you
session.
guys enjoyed our session. And so,
Thank you
ma'am
so
is
much. Thank
so
you,
ma'am is.
everyone.
I hope, ma'am,
Especially
you also
having me,
enjoyed
Divyansh,
our
really.
Yes,
session.
I did. I did. It was actually really nice. Thank you so much. Thank you, everyone, for your questions. I hope you all had a great time as well.
Yes,
All right.
ma'am.
Thank you so much. Have a good day.
Okay. Thank you, ma'am.
Thank you, ma'am.
Thank you.
You too have a good day. दिव्यांश कौन बीच में क्या बोल रहा है